This video is about coronavirus and how does COVID-19 attack our body. So this is a human body, as you can see, and these are our lungs and our respiratory system. This is our heart. These are the blood vessels that take oxygen from the lungs and carry it to the heart. These are called pulmonary arteries. And these two are leg arteries which supply blood to our legs. And this is our brain. So coronavirus has the ability to affect all of these. And in the subsequent part of the video, we are going to go one by one to each of these systems and see how coronavirus attacks this and cause severe damage to our body. So coronavirus here is in the air, and when people inhale it, now it is coming into patient's nose and mouth cavity where it sits and starts growing and start replicating into more and more numbers. Now 40% of the patients will not have any symptoms and they would not know that they had coronavirus, and this probably would be the end of coronavirus. Although we have seen patients in which the chest x-ray shows pneumonia even though they are completely asymptomatic. But in any case, these patients, because they have coronavirus in their nose and mouth, will be shedding the virus and can infect other people up to 10 days after acquiring the infection. Then the coronavirus goes through the air pipe into the lungs and cause what we call as a COVID-19 pneumonia. COVID-19 pneumonia basically grows inside the lung as an infection, and also the immune system, when it attacks this infection, it causes a big time immune reaction, leads to coughing, trouble breathing, decreased oxygen levels, and that is when you hear of people getting intubated and possibly can die from COVID-19 pneumonia. Next, the COVID-19 can also affect your heart. So once it affects your heart, it can cause rhythm problems. The most common rhythm issues that we are seeing with patients who are coming in with coronavirus COVID-19 infection is atrial fibrillation or irregular heart rate. And this is happening especially in people who do not have a history of any heart disease, who are kind of middle-aged, sometimes even younger patients, and they would come with this sudden onset atrial fibrillation or irregular heartbeat. Other patients, this virus can actually weaken the heart by causing what we call is a viral cardiomyopathy, in which the strength of the heart is either temporarily or permanently decreased, and the heart is not able to pump as much blood as it could before. So death can happen by coronavirus affecting the heart too. Third is a blood clot that can happen to patients who have coronavirus, and this is blood clot when it happens in the pulmonary arteries. These are the arteries which take the oxygen from the lungs and carry it to the rest of the body through the heart. Once blood clot happens there is a sudden drop in oxygen. Patient goes into a sudden respiratory failure. There's a sudden onset of shortness of breath, and this is a very life-threatening condition, also known as pulmonary embolism. Pulmonary embolism can be caused by many other conditions, but coronavirus, due to the excessive inflammation that it triggers in our body, increases the risk of blood clotting in these arteries. In fact, we have seen patients who were hospitalized for coronavirus. They went home and then they came back with shortness of breath and pulmonary embolism or blood clot in the pulmonary arteries, and some of them even died from it. So PE or pulmonary embolism from coronavirus can also cause death. Just like in the lungs, coronavirus can also cause blood clots almost everywhere in the body. There have been reports of autopsies done on coronavirus deaths, and findings were that the patients are having blood clots almost everywhere. They are having blood clots in every organ system: lungs, liver, kidneys, spleen. So blood clots can happen anywhere, but here the purpose of demonstrating the blood clot in artery supplying the leg is that these blood clots would cause people to have gangrene of the legs. So if you have heard news reports in which people are losing their legs because of coronavirus, that's what is happening to them. Basically, the arterial blood is clotting, stopping complete blood supply to the distal part, and that can lead to gangrene and septic shock and death, or amputation to save these patients' lives by cutting out the dead gangrenous legs. Lastly, coronavirus can affect your brain. Coronavirus affects the brain and causes coronavirus or COVID-19 encephalitis as well as seizures. These are patients with no history of seizures. We have seen coming into the hospital with severe seizures for which they require 4 or 5 medications, including high-dose steroids, to try to control it. They get confused. Many a times we have also seen patients with strokes coming because of the clotting that happens in the brain. Few patients have come with either one-sided weakness of arm or leg just because they got a stroke, even though they did not have any risk factor. So coronavirus can cause stroke, seizures, and encephalitis in the brain. So this is how coronavirus can kill, and there are many reasons how coronavirus can cause death, and that's why it is such a serious illness. And that's why everyone should be careful, wear your masks, use your hand sanitizers, do proper hand washing every time and frequently, and try to maintain social distance. Thank you for watching this video, and subscribe our channel to support us. Thank you.